make sure I have the proper PPE on. And the fire department has already arrived. So, Captain Wiedemeyer, what do you got here?
We got a 62-year-old male. He has a heart rate of 124. His respiratory rate is 18, and his blood pressure is 136 over 80.
Okay, so it appears that the patient is having some difficulties. So I'll ask him what he's experiencing. So, sir, what's going on?
Heart attack.
What are your symptoms?
My left arm's hurting, and so is this chest.
So your chest and left arm are hurting?
Yeah.
What were you doing earlier today?
I was golfing.
Oh yeah, and what was your last intake? Oral intake. What was the last thing you eaten?
Oh, you know, the usual what golfers eat, the tuna sandwich.
The tuna sandwich. Okay.
Yeah.
So, sir, are you having any trouble breathing?
A little bit, yeah. It's kind of like.
Okay.
That's what it feels like, you know.
Okay, so we'll be sure to get you hooked up to the proper amount of oxygen. We'll put you on 15 liters of oxygen via non-rebreather mask. And then, do you have any history of chest pain?
Uh-huh.
Would it be angina?
Angina, you got it.
When was the last time that you experienced chest pain, sir?
8 months ago.
Okay. Do you have prescribed nitroglycerin?
I do.
Do you have it with you?
I do, actually.
Okay, when's the last time you took it?
5 minutes ago.
5 minutes ago? Okay, so we just reassessed his blood pressure again, and it appears that the systolic blood pressure is above 100, so we can administer the nitroglycerin to him. So, sir, do you have nitroglycerin?
Yeah.
Okay, so we'll make sure that the nitroglycerin, before we give it to him, it's the right patient, the right dosage, the right route, and we'll make sure that we're giving the right nitroglycerin to the patient in the proper time frame. And I cannot put the nitroglycerin in his mouth himself, so I will make sure that I put the nitroglycerin in the patient's hand and direct it towards his mouth, and he will put it in there and to make sure that he gets it. We will reassess his vital signs again to see if it has affected his blood pressure and has brought his blood pressure back to a more normal rate. And we'll be sure to hook him up, possibly to an EKG if he doesn't appear to be getting any better, and prepare to transport him to a hospital as soon as possible.